Hi everyone, this is Dr. Kusuma. Today I'm going to discuss the various types of brow elevation and why they're different and how they're used. So here, if you look again, I did not use AI. I drew it just now before to save some time. So like I said, I want to be authentic content. So if you look at this diagram here, I basically drew a little cartoon of the brows and just an eye and just to reference the landmarks, the nose, etc. Right? So when you talk about the brow, basically you're talking about this entire area, right? All across here, the brow area. These are the brow hairs, but the brow is generally all of this area that people generally want to go north. They don't want it to be droopy. So people love to get the brow elevated. That's why a lot of times we keep pulling like this. A lot of patients come say, I want my brow to go up. So that's the lateral area of the brow that people want to go up north. Same thing on this side, right? Lateral brow. This here is central brow. Central brow here, right? So if you were to look at this, if you take the entire central and lateral brow, that's the whole brow lift. If somebody says, I had a brow lift, the question that should come to mind is that did you have the entire brow, including the central and lateral, or did you have central only for whatever reason, or did you have lateral only for some reason, or some variation thereof? So when you look at a very aesthetically pleasing brow, typically the inner corner here, the inner brow, is usually lower in comparison to the outer brow. So the brow needs to have a very nice, gentle arc in this direction right here. It should not have too much of a curve. This should not be too high. It should generally start low and have a very nice arc at an angle that goes to the corner in this fashion. So that's what looks very attractive. Anytime the brow curves downward like this, it always makes somebody look sad. So when people always want the lateral brow elevation, they're trying to minimize this curve and the lateral descent, and that's the lateral brow. Okay, so how do you go about doing this elevation if you were to do it surgically? Okay, it's gone through an evolution. Before, like in the 1980s, 1990s, maybe to some extent now, we used to make, I'm not that old, but we used to make incisions all across the scalp, in the center of the scalp, pull all of this down and elevate the entire brow, which was the original way brow lift was done, which I do not like, never liked it, and it's not a good operation for most people. Then we went to the hairline. So typically what happened in this case is that we would only elevate the hair right in front of the hair and then not cut into the scalp and try to hide the incision in the hair and elevate all of this if you need to do the central brow elevation and extend it as far onto the side as necessary. Okay, so that's the second. So why would you do a central brow elevation? Typically, the face is broken into the thirds, where the top third, the middle third, and the central third should be fairly in good proportion. Males can have a little broader one, because they have some receding hairline, but females generally would look better if they have an evenness of the thirds. So if the females have a lot of forehead compared to this, it's also good to bring the scalp down to create symmetry and at the same time elevate the brow so that the central brow elevation makes sense. Some patients have a lot of excess skin right in this area here. And the only good way to do that is to elevate that skin so that that little drooping here won't happen, right? So that's another reason. But for an average person, the best thing to do is to do what we call a lateral brow elevation. Lateral brow elevation is done, by pulling the brow area in the direction and vector that you would want to have it elevated. So you have to kind of see where the brow position is going to give an optimal look for patients, and you basically map it out. So this is the area that I would like to elevate. And then once you map it out, you would then design an incision within the hairline and hiding it in the hairline along the side. Like if you were to look at me, if I'm going to elevate this part, I would try to elevate and kind of design an incision along the side that pulls this area up. Some people may only need a little bit, some people may need a long one. Again, this varies on where you're trying to elevate the brow. So that area is designed so you break up the scar in a way that kind of hides it within the hairline, so it doesn't look like a linear line, right? And then once you create that, you would then dissect all of that skin all the way down here, over the actually the bone of the orbit of the eye socket here. And then you can really see how well you can pull that skin up. In addition, the deeper tissues here, just like in the neck, you have the SMAS tissue that extends into the brow area as well. You can elevate that here also, so that you can almost get a little bit of a SMAS elevation, because you're dissecting through here, all of this area here, all of this too. So you can almost get some elevation of the SMAS as well. And then you can plicate it, which is to kind of suture it up. And then you see how much pull you want of that skin you dissected. And then whatever excess skin you have that's been pulled up, you cut it and discard it out. You throw it out. And then you are able to do some nice suturing there. Okay, so that is a lateral brow elevation that elevates the corner of the eye in a direction that you want it to go, and the extent and the length that you want it to go. It's a great operation to do because it does a number of things. It brings the receding hairline down. It elevates the brow in a very specific way. It's a very direct way because it's pretty close to the brow. This incision for the most part heals fantastically well. In some patients, it may not be ideal, so you have to do some scar revision. You may need to do something. Sometimes if the incision is visible, you may have to do some microblading, to create, just like you kind of create brow hair. You can also kind of hide it if needed. But if you wait long enough, it usually heals very well and hides nicely, and people don't have a real problem with it. This surgery can be done under local anesthesia. It can be done under anesthesia. Again, people need to know. It can be done under local IV sedation. So both can be used. General anesthesia where you put people to sleep is absolutely not necessary for this surgery. It's an overkill. It's not necessary. So typically I do it under local anesthesia or IV sedation. So when you do this, you can imagine it's at the top part of the head and you are working downward. So any swelling, any bleeding typically that happens, which is inevitable, can start to come down the face, and you can see some swelling of the face, some bruising. It can go down into the jawline. It can go into the neck as well. But that typically heals fairly fast. So the bruising and swelling, and sometimes it can go underneath the eyelid as well and can look bruised. And a lot of people get confused. Why did my lower lid bruise when you're doing here? Because all of that dissection is done all the way to the brow rim of the bone. And some of that, because this is a very thin, delicate area, some of that swelling can extend down into the lower lid as well. So this is a lateral brow, central brow elevation. And if people want the entire thing, of course, you can do that as well. But many times I recommend when patients do a lower face and neck lift surgery that they consider this lateral brow extension, because we can really create a very nice vertical oblique elevation of the entire face that looks sharp and looks, I guess, very elegant and very refreshed and very much put back where tissues used to live back in the day when all of this, descended downward. So that's something I hope is educational for you guys to understand and ask questions about. And where the surgeon places the incision, whether it's right by the hairline, inside the hairline, far into the hairline, that's something you can discuss with your surgeon and find out. And everybody may have their own reasons or, explanations of why they do what they do. I have my own conversation with patients when they come, and I do, I'm kind of presenting, what I discuss with patients. So hopefully that'll be helpful. Thank you so much.